Thank you. So I was asked to talk about increasing health equity and transplant volume. So I will show how we did it at Temple University lung transplant program. I've been doing lung transplant since 2004, 7 years at University of Pittsburgh and 11 years at Temple. And I'll share my experience. Just for international and non-transplant audience, this OPTN, Organ Procurement and Transplantation Network, is a network that links all professionals involved in transplantation in the United States. And transplant center like us, or the organ procurement organization like Gift of Life Philadelphia, they are the member of OPTN. And OPTN is administered by UNOS. It's a United Network for Organ Sharing. And the SRTR is a scientific registry of transplant recipients. SRTR provides data to OPTN. So OPTN has 5 strategic goals, and one of them is to provide equity in access to transplants. So disparities can occur in many steps of transplantation process. First is access to the waiting list. This includes referral to transplant centers and listing among referred patients. And once listed, waiting list mortality, transplant access, post-transplant outcome can have disparities. So OPTN developed Equity in Access dashboard. This monitors a variety of characteristics, including race, age, obesity, socioeconomic resources. So our program was in trouble in 2011 because of the bad outcome and low volume, and our program was inactivated then. And external reviewers from prestigious institutions came, and they recommended strict patient selection, including recipient age no higher than 68 and BMI no higher than 30. And we reactivated the program in 2012, and we did 14 lung transplants for the first year in 2012. And our recipients, 43% were African American, compared to 8% nationally. And 36% were age 65 and older. Nationally, it's 27. And 36% of our recipients are BMI 31 and higher, compared to 10% nationally. So clearly, we didn't follow the recommendation by the external reviewers, yet we were able to achieve excellent outcome. 1-year survival rate 91% compared to 81%. And that prestigious center where one of the external reviewers came from, only 3.7% are African American, 94% white. And they didn't do any patients, BMI more than 30. So Temple was much more inclusive, yet we achieved excellent outcome. So I want to show this. This is a total number of persons in poverty per zip code in Philadelphia. As you see, Temple is right in the middle of the poverty area. In our service area, 46% were African American, 30% Hispanic, and half had Medicaid, and 2/3 of the population had household income under $50,000, and 1/4 were below poverty level. And this causes barriers to health care, including lack of insurance. They cannot pay out-of-pocket expenses, or they cannot even provide transportation. Even basic needs are not met in 27% of the patients. So when we restarted, 15% were Medicaid, and now we have many patients coming from all over the United States. Its Medicaid rate is 5%. And this is the most recent SRTR data. Now our African American population, 9%, that's about similar to the United States national average. But still we provide older patients. 32% of patients are age 70 and older, compared to 14% nationally, and continue to provide obese patient, and outcome maintain good, fewer than expected mortalities. So we were able to increase health equity and increase transplant volume, and we maintained good outcomes. This leads to, we became the largest center in the United States in 5 years of the last 6 years. So many patients coming from all over the United States because of the high age or the comorbidities like coronary artery disease or complex procedure like retransplantation. And importantly, this is the post-lung transplant outcomes, and outcomes are excellent for minority patients. So in conclusion, we do compassionate, inclusive, and non-biased, non-discriminatory, very optimistic approach so that we increase health equity and transplant volume while maintaining excellent outcomes. So we include everybody, and we never say no to anyone. Just kidding. Thank you.